Hello, my name is Dr. Branson Collins. I'm a triple board certified anesthesiologist, pain management, and integrative medicine specialist. I want to bring to your attention this article from 2008, almost 20 years ago, from Rheumatology, that was looking at intestinal permeability in patients with primary fibromyalgia and patients with complex regional pain syndrome. And what they were noting is that the degree of small intestinal bacterial overgrowth, also known as SIBO, is often associated with increased intestinal permeability. And even more importantly, in the chronic pain population, has been shown to potentially be associated with increased pain intensity. So when they looked at these groups, it was a small study, 40 patients with fibromyalgia, 17 patients with CRPS. And what they concluded is that intestinal permeability in fibromyalgia and also in chronic regional pain syndrome were increased. The clinical significance of this is that if somebody's colon and intestine is permeable, there can be additional inflammation happening because there's an interface between what's inside, namely bacteria, and also what's outside, the bloodstream and the immune system. And in certain patients, this may actually be worsening the underlying pain condition and could potentially be contributing to intractable pain. And that's why in my clinical practice, in addition to looking at the gut, the diet, and also optimizing nutrition, I will also do testing for small intestinal bacterial overgrowth with a breath test to determine if it's a contributing factor. And if it is, I will actually often prescribe an FDA approved medication called rifaximin, which can eradicate the SIBO. You follow that up with something like a low FODMAP diet so that you'll continue to feed the organisms that are associated with SIBO. These are mainly methane and halothane producing organisms. And in many times in my experience, this can significantly improve the underlying pain condition. Now, this can often be done in conjunction with the FDA approved medications like Lyrica and Cymbalta. But I have found in my practice that if you get to the root, which in many cases for people is their gut and also their gut immune interface, you actually do very foundational work to improve their pain outcome.